MRS you perform during the practical exam, you have to give them a same instruction. You're going to do this on your skin, compare the sensation on both sides. Tell me if it's different, tell me which side is more sensitive than others. So can you put your hand like this? Okay. So C6 is along the lung channel, right? So is this feel same as this?
This more sensitive.
That's more sensitive. Okay. Right? That was C6. And C7, nerve root, wrist flexor. So make a fin and bring it up like this. Same thing. You're gonna stabilize patient's wrist, and then the other hand put on top of the fist, and you're gonna push this down. You're gonna keep this position. Okay, ready? Hold. Ready? Hold. Okay, that's wrist flexors. And tricep. Tricep, there's a lot of ways to do it. Easiest way is this. Easiest way is you lift the patient's arm up like this and let it hang, and you hit like that. The other side. Like that. Okay? That's a tricep. And sensory for C7. Once again, I'm going to do this on your skin. Compare the sensation both sides. If it's different, tell me which side is more sensitive than the other side. Okay, palm up, please. Is this feel same as this? On this side. Okay. And then C8, finger flexors, muscle. And you guys do this. Okay. For finger flexors, you have to stabilize the patient's hand. I'm going to put this down. Don't let me do it. Okay, hold. Same thing, and hold. Okay, and reflex for C8 is brachioradialis. So you do the same thing that we did for C6. Okay, for sensory, again, instruction. Okay, and can you put your palm up? Okay, and is this feel same as this? Okay.
Which area we mentioned for that one?
Oh, C8 is along the heart channel,
Heart channel.
and of course it goes to the fourth finger too. But okay, that was for number 1 through number 4. Okay, next one is ankle range of motion. Range of motion, when you perform range of motion, you have to watch patient's movement. When you perform the range of motion, if you do not watch it, I will cut out the point. Usually for the ankle, it's better ask the patient to sit down. Remember in the United States, you tend to get sued. So if you perform the test in standing position, and if they fall, then there's a chance that you get sued from the patient. Okay? So ask the patient sit down like this. Okay? And ask the patient to mimic your movement. Can you do this like this? And any pain? And bring your foot down like this. Any pain? Okay, that's neutral. And bring your first toe up like this way. And pinky toe up this way. Any pain? Okay, that's range of motion for ankle. You have to remember the normal range of motion. Okay? In the cervical range of motion, flexions, bring your, you told me? Bring your chin to the chest. And you have to watch the patient's movement. Okay? If you stand here, then you cannot see how far patient move, right? So you have to stay a little bit on the side, either this way or that way, to see how much they are able to bring it down. Okay? If you stand in front of the patient, I will cut at the point. Okay? Show me, how far can you bring your chin to the chest? And this is flexion. Can you tilt your head up? That's extension. Right? And back to look straight. And for rotation, you have to stand in the front. Right? And you turn your head to the right side. And the other side. And look toward me. And lateral flexion, can you show me how far can you bring your left ear to left shoulder? Right ear to right shoulder. Any pain you do that? And that's a lateral flexion. You have to remember normal range of motion for that term. Right? Wow, this time there's a lot of range of motion.